The mission of the Rideout Foundation is to invest in the well-being of our community. I have wanted to have the Vinci robot at Adventist Rideout for a while, and so I'm so excited that the foundation has approved and purchased this machine. What it's going to do for our community members is amazing.
Adventist Health and Rideout is getting the Vinci 5 robot. It is the latest and greatest, I'll add the greatest version of the Vinci surgical platforms.
So the Vinci 5 robot is the newest iteration of Intuitive's robotic system. It allows us to do complex, minimally invasive procedures in a laparoscopic manner in ways that we couldn't do them before. It allows us to provide operations with less pain, faster recovery, and sometimes fewer incisions. It'll allow me to do more complex surgeries that I can't usually do laparoscopic.
The machine in and of itself is a machine. It's not trained yet to do surgeries on its own, but we have surgeons who are capable of using this technology. The technology just advances their own skills. So here we have this group of physicians who are trained. They know how to use this. The outcomes for the patients are so much better. So we put the best tool in the hands of the best surgeons, and the outcomes just go that much better.
Rideout is incredibly blessed in the physicians that choose to practice at Rideout, and particularly with our surgery team. Our surgeons have invested their careers here. They came here wanting to establish and build a lifetime of service to this community. And when we talk to them about what their priorities are, robotic surgery was number one on their list. Being able to care for their most medically vulnerable patients here at Rideout is paramount to them. And it gave the foundation board pause to hear Dr. Garcia say if he was starting his career over, he would not choose a hospital that did not have robotic surgery. And that's what we're facing with new surgeons coming out of training. And so it's absolutely vital to the well-being of our community into the future that we have robotic surgery.
I know patients who cannot drive to Sacramento. They find it hard driving that far, and you can go and have a surgery done somewhere else, but what the follow-up? Sometimes you need a follow-up and then you have to go 2-3 times. It could be very taxing on the patient, their families. So having something available right here is really a great, phenomenal idea, and we can make it happen by having this technology.
Our patients and their families will be able to receive their robotic-assisted surgery close to home. So currently we've had a number of patients that have had to go to Sacramento or even as far as Southern California. So that adds to expense, it adds to stress. You're traveling when you're not feeling well, and that's not what we want for our patients. You know, even just going an hour down the road for a pre or post-op visit can be challenging. And if you have to go further out than that, it's expensive. You don't have your support network, you don't have your regular doctors. So having care close to home is much better for our patients.
If it was my mom that had to have a procedure, knowing that our hospital is only a couple minutes away from our home, how quick it would be to get her here, the less invasive surgery. She wouldn't have to stay in the hospital as long as she normally would if we didn't have the robot. So it's very satisfying and reassuring.
Bringing robotic surgery to Rideout is the single largest commitment the Adventist Health Rideout Foundation has ever made to a project. And that was a big leap of faith on the board's part, but that just shows how important bringing robotic surgery to Rideout is to them. But we've been able to do that because donors have entrusted funds to us over the decades preceding this. And when the community comes out and supports the foundation, we are able to invest in future projects.
As you support the foundation, this foundation supports the hospital, it turns back to the community in terms of really, really good care, world-class care.
So what this country is about is philanthropy, you know. You cannot have everything, the best technology. So it's very important for us to contribute, support, and be generous so we can get this technology to this community, and it's basically helping everybody. You know, it's gonna improve the access to the whole community. So I would request all those folks who are well off, who are blessed, please make some contribution to support this technology so we have the best state-of-the-art technology right here so we don't have to go anywhere else.
I'd like to thank the foundation and the community who helps fund the foundation, who contributes to the foundation for making this a reality. Their dedication to innovation in this area is why I love being here, and why I love working here. And I'm happy to provide this care for patients.
What I do say to others is, come on, get on board. We need the entire community. We need all kinds of people who are willing to volunteer, who are willing to help raise money, who are willing to write checks. The entire community has to support this effort in order to maintain and sustain our community hospital.
I want to say thank you to everybody in our Yuba-Sutter community who supports the Rideout Foundation. It means so much to myself personally and to our foundation board. We're so excited to bring the Da Vinci robot to our hospital, and I just can't say thank you enough. We greatly appreciate it.